here with us today for our Strong Families, Strong Communities, a messaging roadmap for prenatal to 3 policy. We are so glad to be joined by advocates across the country. We're expecting a large turnout, so we're excited to see who shows up. You are the ones doing this work every day, often in complex political environments, and always with families and young children at the center of what you're doing. Before we get moving, I'm going to just encourage everybody to help us out and stay on mute unless you are speaking. We have a lot to get through today and some great speakers to hear from. Also want to encourage you all that while we're asking you to mute, we're not asking you to mute your questions. Definitely want you to insert questions throughout in the chat box. If it's something easy, we'll respond immediately. And then otherwise, we will take note of them, and we will have a Q&A section at the end and follow up after with anybody who we didn't get to. So today is about giving you practical research-grounded tools to help make your communications more impactful, more strategic, and more tailored to what your audiences need. Over the past months, NCIT has invested in a robust, bipartisan research effort to better understand one core question, and that is what actually moves people, both policymakers and the public, to support policies that strengthen families during this prenatal to 3 period. This work that you're about to hear about reflects deep listening to voters across the political spectrum, parents, non-parents, other groups, and to both Democratic and Republican state lawmakers. And what this research makes very clear is that we are in a different moment than we were even in a few years ago. The case for why prenatal to 3 matters has largely been made, thanks to all of your great work. Awareness is high and agreement is broad. The challenge that we're going to talk about today is how do you close that gap between belief and action, and where communications becomes a critical lever in that gap closing. We're also excited not just to share the research findings, but a brand new messaging guide that you can put to use right away to use for conversations and external communications. So before we dive in, I'm going to quickly introduce who you'll be hearing from today. I'm Nicole Bender, Senior Vice President at GM&B, an issue-based communications firm located in DC. And I'll be walking through the communications implications later in this presentation. I want to give a nod and recognize Allison Frazier, who most of you probably know, who's the National Senior Director at Voices for Healthy Kids. She spearheaded this work. And then you'll be hearing momentarily from our great research team, Rebecca Nazer and Jay Campbell at Heart Research and Eleanor O'Neill at Echelon Insights. And then my colleague, Nikki Melamed, will be joining me at the close of the presentation on the messaging guide. So our agenda today is short, but we have lots to say. The heart of the conversation will be the research team presenting our key findings, and then we'll briefly move to communications implications. And then we hope to have plenty of time to have questions at the end. So I'm going to get things started and turn things over to Rebecca at Heart Research. Rebecca, take it away.
Wonderful. Thank you so much, Nicole. Hello to everyone. Welcome. We're so excited to share what we learned from the research that we conducted over the last roughly year or so. As Nicole said, this was an incredibly robust research plan or research design. I'm going to first start by telling you a little bit about what we did, and we can go to the next slide, please. And then I'll set a little context, and I'll turn it over to my colleagues, Eleanor and Jay, to talk through some additional findings and the strategic recommendations from the messaging testing. But we did 4 phases of research, 3 qualitative and 1 quantitative. We initiated the project with 2 3-day qualitative online discussion boards. We did those way back in May of 2025. It feels like forever ago. We did one with what we call informed and engaged voters. These are people that are highly news attentive and they're involved and engaged in issues that they care about. And we did another with conservative archetype voters. And these folks were divided into 4 segments all along the conservative side of the spectrum. And they were based on the work that was done by Voices for Healthy Kids in terms of a segmentation analysis that they did to categorize conservative voters sort of into different buckets. We then did 5 online focus groups. You can see there the groups that we talked to, local business and community leaders, Black voters, Latino voters, parents of kids under age 6, as well as seniors age 65 and older. And then lastly, we conducted a national online survey with a very robust sample. Our main sample was 1,200 voters, and we did oversamples of Black, Latino, and AAPI voters, as well as an oversample of parents and young kids to yield a total sample of 2,154 voters. We matched to the voter file. We do that for a couple of reasons. One is to just ensure that the people that we're surveying are the people that we think they are, but it also allows us to append data from the voter file for our tabulation and our analysis. We did something with the quantitative survey called cluster analysis, which is a statistical technique that we use to group survey respondents into clusters or groupings based on common characteristics as well as attitudinal measures. And what this does is allows us to see patterns in the data that are not evident when we're just looking at demographic characteristics or attitudinal measures based on survey questions. Most importantly, what this allows us to do is identify different approaches to framing and communication that work for different target groups of the electorate that we want to move and motivate on this issue. And Jay will talk more about that when he talks about the messaging that was identified as the most effective way to communicate and make the case for investments in PN-3 programs and services. The reports for all of these different phases of the research will be made available online if you want to read sort of all of the gory details. If we want to go to the next slide, I'm going to begin by setting a little context, as I said, and then I'm going to turn it over to Eleanor. But just the very first, very important point that Nicole touched on is that the public fully understands the importance of that prenatal to 3 period. This was an empirical question when we first started doing this work many years ago. There is no need to spend time or resources making the case that this is a critical period in children's lives. If we go to the next slide, please. You can see here by this graphic that voters really do get it, regardless of whether we are talking about mental and emotional health, ability to learn into the future, or physical health. Very large majorities of voters tell us that they think that the PN-3 period in a child's life is extremely or very important. So majorities tell us they think that that period is extremely important. As you can see from the right side of the graphic, this is not just the case among people that have kids. This is the case among the segments of the public that don't have children as well. So we don't need to make the case. That's already sort of baked into the cake. So, and while voters think that that period in time in a child's life is so very important to their development, they don't think that we as a country are really measuring up in terms of making sure that families that have young kids have the supports, services, programs that they need to ensure their kids develop in a healthy way. They believe that we need more programs and that the programs that we have need to be enhanced and improved. And there are slides regarding some of those questions in the larger decks. If we want to go on to the next slide, please. Another really important key finding that really does signal that we are starting on pretty solid ground is that voters believe that the government has a very critical role to play in supporting families with young children. And as we would expect, among state legislators, there's a more nuanced point of view. They are more focused on the practical realities and what is feasible and what it's going to cost to fund these programs, to create and fund these programs. But really across the board, as you'll see on the next slide, there is agreement that there is a role for government, and in fact, that the government needs to be doing more to support families with young kids. So here you can see in the survey we asked, should the government be doing more? Should it be doing less, or should it be doing the same amount as it is now to support families with these young children? Among all voters, 65%, so 2/3 say the government should be doing more, a full third say a lot more, and among parents, that number is even higher. 3/4 say that the government should be doing more to support families with young kids. 45% say a lot more. And if you look at the right side here, we're not going to go through all this data in detail, but the big takeaway is that this point of view is the majority point of view across the electorate, that the government needs to be doing more, not less. We asked a follow-up open-ended question here in the survey, why they think the government should be doing more, to the folks that say the government should be doing more. And the takeaway here is that people just acknowledge and recognize that families with young kids are really stretched. The affordability crisis that's hitting everybody across the country is hitting families with young kids especially hard, and they need help with just what I would characterize as the bare essentials: healthcare, childcare, those kinds of things. Go to the next slide. We wanted to get a sense or a read on where voters come down on a range of 9 different policy goals and objectives. So these are really, we frame these as goals and objectives because they are not specific detailed policy proposals. But the good news is that the electorate overwhelmingly supports all 9 of these different policy approaches that would help provide enhanced supports to families with young kids. And we went at this 2 different ways. So the number in the right column, we first had them rate each of these in terms of whether they support or oppose. And so as you can see, and what we're showing you is the proportion who strongly support. So 73% of voters support making sure that young children have access to affordable health care, 64% that young children are provided with nutrition assistance, and 62% making sure that they have stable, affordable, and safe housing. Those 3 top policy goals and objectives are the top 3 across the electorate among Republicans, Democrats, and independents, and majorities tell us that they support those. The bars are showing you, after we had them rate each of these in terms of whether they support or oppose it, we had them rank them. So they could only pick 2 or 3, and they had to rank the ones that they think are the most important. And again, it's those top 3, as you can see, across the board. Among state lawmakers that we interviewed and the IDIs that we conducted as the 4th phase of the research, tax credits and nutrition assistance were the most promising standalone policies that lawmakers think will make the biggest difference in the lives of families with young children. And I should have mentioned at the onset when I was mentioning what we did, the last phase of the research was 12 individual in-depth interviews with state lawmakers. They were split evenly between Democrats and Republicans, and that's where that data point comes from. So I'm going to turn it over to Eleanor now.
Great. And if you'll move to the next slide. So of those state lawmakers who we interviewed, many of them see the value in a holistic approach, but they question the feasibility. Some of the obstacles that they identified were financial constraints, so concerns about the budget, as well as funding streams, so implementing a program that would rely on a federal match, and whether that would be reliable or feasible. limited understanding among some of their colleagues or awareness of best practices. So some of their colleagues may not really understand or know what the value of something like this would be, and would therefore be less likely to support it. Some had philosophical objections primarily to the idea of big government because a comprehensive approach sounds like a lot of government all at once. Uh, and then some concerns about workforce shortages and not having enough workers for programs like daycare and home visits. Some also suggested that implementing these services individually might insulate them better from budget cuts than if they were all part of a single law. We'll go to the next slide. Specifically for conservative lawmakers who may have some concerns about big government and also about money being spent, is there are entry points for them that don't have to do with money. And it's important to recognize that. And it's also important not to only focus on the dollars and cents or to lead with that, because it may be perceived as thinking that conservatives are heartless and don't care about families and communities. And that is something they do care strongly about. So some of the top messages with Republicans were really focused on strong families. And kind of tying that in is kind of an important way to reach them and get support for these programs. Another way to help approach them is to find allies who are socially conservative or already kind of on these legislators' teams who really believe in this idea of families as a building block of communities. So those could be from pro-life groups who are looking to support policies that support babies and moms, as well as groups that are pro-family. Since one concern conservatives may have is about programs that would pull a family out of a home or replace a parent with government. So having groups that can communicate that they do support families and giving families options and making families healthy and prospering, and how that benefits kids and communities can also help these conservatives who might otherwise have some more reservations really buy in to this approach more. We'll go to the next slide. Insisting that the programs are universal may cause problems with some voters in the electorate. So overall, when we asked about who should be eligible, voters are pretty narrowly split, with 51% saying that only families who need financial help should be eligible versus 46% who say all families should be eligible. But particularly for Republicans, they fall more into saying only some families should be eligible for this, so only those who need financial help. So insisting that this be a universal program that all families would be eligible for may make them less likely to support this than they would be otherwise. And with that, I will hand it over to Jay.
Thank you very much, Eleanor. Um, I'm going to talk a little bit about the messaging, the testing that we did, which was a big part and a big impetus for the research. Allison and the funders for the project wanted to be able to provide you all with those who, as Nicole said, are doing the work every day, with some guidance as to how to best talk about the PN3 years and the need for PN3 positive policies and the like. So that was sort of a key portion of the research. The good news is that we found a number of highly compelling frames, message frames, narratives, however you want to think about it, that both the public and the Republican and Democratic policymakers we spoke to saw as compelling reasons to support PN3 policies. The less good news is that we did not find that we did not test and be able to come up with evidence for proof points that show how well PN3 interventions tend to work. We tested a set of proof points for why they're important to have, sort of the why rather than the what. And the efficacy point is really important, as you can see from the next slide before I go into depth about the messaging, is there's a real need to demonstrate that efficacy. At the moment, just 40% of the voters in the survey that we spoke to think that the policies that the programs that they're aware of in their communities are actually effective. Only 5% say that they're very effective. That's a pretty sad number. And in point of fact, those who think that they are not particularly effective outnumber those who think that they are. That gap gets even a little bit bigger for parents of very young children. 51% say that the policies in their area and the programs in their area are not effective. And if you look to the right on the table, those parents who don't have a college degree, so lower socioeconomic status families who are meant to be helped more than even anyone else by these policies, are the most apt to say that they're not particularly effective. So there's some work that needs to be done there to demonstrate, promote, and prove the effectiveness of these policies. Now, having said that, on the narrative point and why these policies are valuable, if you go to the next slide, or why these policies are needed, we tested 7 messages in our research, both in the voter survey, and I think we narrowed it down ever so slightly for the policymaker research. Of those 7, we found that there were 3 that audiences were most drawn to as compelling reasons for why PN3 policies and why funding for those policies is necessary. Starting on the left, we had a message around benefits to the economy and benefits to the workforce. And just to be clear, the titles you can see at the top of each box were not part of the research. Those are just our shorthands for them. Our respondents only saw the text in the middle of the box. On the economy point, the idea that a strong economy depends on strong families, and you get to a strong family by investing in these positive prenatal to 3 policies. That idea was broadly compelling, I should say, but particularly the Democratic policymakers that we conducted interviews with were drawn to that. Interestingly, and I'll talk about, as Rebecca mentioned, the audience segments shortly, but we had this one particular audience segment of right-leaning voters who were very strong boosters for PN3 policies. They too really liked this economy and workforce line of reasoning. Excuse me. In the middle, we had a message about, which also sort of talks about strong families, but sort of takes the next step, that strong families are the foundation of strong communities. I'll say that Eleanor's colleague, Kristen Soltis Anderson, was heavily involved with this project as well. And I know she was particularly drawn to that phrase and to that framing. In a separate message test, we had people highlight phrases from messages that they found to be particularly impactful, and a great number of people highlighted strong families and the foundation of strong communities, that first sentence there. So it's really, it seems to be something that touches people in a good way. And sure enough, for those Republican lawmakers that we conducted interviews with, they really liked this one. They liked the fact that it sort of brought the idea of strengthening the family down to the community level, and how that spreads out once you've really been able to shore up families in a way that makes children healthier. This was also particularly compelling for groups of voters in the survey who were sort of inclined toward saying that the government should do more on PN3 policies, but weren't all the way there. If you think back to Rebecca's slide up at the front, it was about 34% of voters who say, yeah, I think government should be doing somewhat more than they are now, but weren't kind of all the way there with saying it should be doing a lot more. So those kinds of voters that we need to, that are already inclined to be with us, but need additional boosting. This is a pretty strong message to reach that audience. And then finally, one of the other ideas that we wanted to see if we could push back on was the notion, sort of an implicit notion that is out in the ether, that there are certain families that really don't deserve public health help, rather, for one reason or another, because the parents aren't working, because they have too many children, any number of reasons that are given for that. And we wanted to find out if there was an answer to that criticism. And in point of fact, there is. The message we tested here, that every child deserves a chance to live a successful life, and every family deserves the help that they can get to make sure their children have that chance, is a strong message. Again, for many audiences, but we also had a small number of voters who, from the beginning of the survey to the end, became more inclined to say, yeah, you're right, government should be doing more here. For that mover group, this was a particularly compelling and interesting line of messaging. Next slide, please. One of the things that surprised me about the research, I think surprised several of us, is reactions to what we call ROI messaging, return on investment. In all the work we've done in the past on early childhood education and on early childhood policy, this has been a really important talking point. And frankly, with the public, continues to be so. The message we tested that was in that lane were, look, we're going to pay for it now, or we're going to pay more for it later. And for that mover group who became sort of more amenable to government action by the end of the survey, this was another good message for that audience. It came a little bit to a screeching halt when we did the policymaker interviews. The Democrats we spoke to were pretty well on board with this. They said that this was something they were aware of, they had heard, they believe it to be the case, and they thought it was a strong reason for PN-3 policies. The Republican lawmakers had a different reaction. For one thing, they say, look, we hear this, if you spend $1 now, you save $5 in 10 years down the road, or in 5 years down the road. We hear that a lot. We hear it about a lot of different types of policies, everything from, yes, education to infrastructure to you name it. And the reality is a lot more complicated. It's not as simple as you drawing a bright line from spending $1 now to saving $5 later. And as such, they tend to put less faith in it. And the other idea here is, and this was sort of hinted at without being directly said in many cases, these are people who are only in office for a limited amount of time. They don't know how long they're going to be in office. So if you're telling them that an investment that they vote for now will pay off huge dividends in 20 years, that's kind of less interesting to them from a political standpoint, because they're probably not going to be in office at the time that they can claim credit for it. So, from their perspective, shorter term payoffs can be more important. And the third point they make is, there's only so much money in the pot right now. I mean, you're telling me I'll save money later. That's fine and great, but that doesn't create more money to spend now. So there are a lot of limits is the upshot to this message. We did find that there was some value around it. One proof point that we tested in those policymaker interviews was the idea that participation in the WIC program reduces preterm birth risk by 25%. That got some nodding and some agreement, and more statistics like that that can be tied directly to very specific programs with very specific outcomes. There could be a little bit of value there from an ROI messaging standpoint, but on the whole, this is something that needs to be deployed pretty carefully, I'd say. Next, please. I have 2 more slides to show, and they are both related to this audience segmentation we did within the broader public. So as Rebecca explained, we ran a statistical tool that groups people by both how by their demographics and as well as how they think, and divides them into categories. And so we ultimately divided people into 5 different categories. The 3 that are more important here are the 3 that are in the middle. It adds up to 52% of the voting public nationally. Those on the far left on the screen here, the pro-federal progressives, they're kind of your ride or die, hell or high water group that's always going to be with you on PN3 policies. So don't need to spend a lot of time trying to talk to them because they're already there. On the right, what we call the rugged individualists are the literal opposite. They're the group you're never going to get no matter how hard you try. So any time and effort spent on trying to reach them is wasted. The groups in the middle are more gettable. And we like these 3 because they demographically look a lot different from one another. So you have the ability to target a lot of different demographics among these 3. And just to briefly sort of talk about them, what we call the working class bystanders. It's not shown. There is a lot more detail in the full deck about every single one of these, much more detail than you'll probably ever want. But this group is lower socioeconomic status. They do not spend as much time following the news. They're not particularly civically engaged, which is why we called them bystanders. And they, on the whole, lean a little bit on the conservative side. The group in the middle are the one I mentioned before. These are very strongly conservative leaning. You can see that ideologically they are more conservative than liberal by a 38-point margin. That's substantial. And they're heavily, heavily Republican. And interestingly, predominantly male. But also the one category that is a majority have a child under the age of 18 in their household. And they express very positive attitudes about PN3 throughout the course of the poll. The one trick about them is that they're a little less likely to think that more needs to be done than is currently being done. So they need to sort of be brought along in that regard. And then the third target group are what we call the pessimistic skeptics. It's not shown here. The reason they're pessimistic is because they think that the world is terrible right now. They think that young children right now are sort of facing worse outcomes now than they have in a long time. So they're in a pretty dark place personally. They are of these 3 groups the most democratic, which explains part of the reason why they think things are so terrible right now. But they have the ability to be brought along as well, and thus make them a pretty good targetable group. The way to talk to these folks is shown on my last slide, which is the next one. It's the same 3 messages that I showed you already. It's just a matter of emphasis. So for that bystander group, talking about how families and every child in every family deserves to a chance to thrive and be helped. The economy and workforce message is powerful with them. That conservative group, I already noted the economy, workforce, and strong families and communities are the way to reach that group. That strong families and communities one in particular is really good. And for that more pessimistic group, all 3 of the top 3 are good messages to use here. This is why we highlighted those 3 a few slides ago, is they do a lot of work. Among the 3 of them, you can cover the whole waterfront for any sort of key group you'd want to target and make a pretty good case for why PN3 policies are important. With that, I will turn it back over to Nicole Bender from GMMB.
Thank you, Jay, and thank you to the whole team. That was great. And I also want to assure you that everybody collectively on the call, there were many rounds of research and many in-depth reports that were produced. I am highly impressed that they just got through what they did in the time that was allotted to them. But for those of you that want to do deeper dives and look at breakdowns, there are more extensive report outs from each phase. And my guess is that if you wanted to go even deeper, there are crosstabs behind that. So just wanted to reinforce that this was months and months of work just summarized into 30 minutes. So reiterating a point here on implications, that one of the biggest things that came out of this is that if you can hold there, we don't need to keep convincing people that prenatal to 3 is important. That work's largely been done. The real opportunity now is showing people what meaningful, achievable action looks like in ways that align with their values, priorities, and constraints. So onto the opportunity here. Again, voters already believe that prenatal to 3 is critical, but more than half think that we're falling short. So that gap between belief and action is where communications matter most. The opportunity to continue momentum, we're finding, is not around the big ideas of the value of this period, the big vision and promises, but it's really focused on conversations around near-term, concrete progress that shows both policymakers and families that it is doable to close this gap. So if you go to the next slide, we took all of these findings to build what we're calling our broad tent core narrative. This is tested as the broadest and most durable foundation across all the audiences. And I'm going to take a moment to read it to you, and then we'll break down why we think it works. So here's my story time with Nicole as I read this. Building strong communities means focusing on what truly matters, and that begins with supporting strong families. A healthy start takes more than just one factor. Safe housing, nutritious food, caring environments, and stability all shape how children develop. Families are struggling to provide even the basics like groceries, healthcare, housing, and for those with babies and toddlers, the added costs of formula, diapers, and childcare. This is where state and local governments can make a difference. They can invest in our communities by supporting families during those crucial first 3 years of a child's life. Government can't and shouldn't raise our children, but it can make sure childcare is safe and affordable, healthcare is accessible, and families can afford the essentials they need. When we invest in young families, we build the foundation for families to thrive, for children to grow into successful lives, and for the kinds of communities where we want to live. So why does this work, and how did we build this? Well, it's worked because of how it's structured. We lead with a shared value, strong families and strong communities, because we know that that worked the best across the board. Next, we recognize that children need many things to survive, or to survive and thrive, which opens the door to a broad range of policy solutions. We then name the tangible everyday pressures that families are facing: housing, food, childcare, healthcare, which everybody identified are what people are struggling with right now, and clearly define government as a supportive partner, not as a replacement for parents. Naming all of these pressures is essential for credibility right now. So this structure, it builds trust. It gives you room to pivot to specific policies that you're working on without reopening debates around parental responsibility or government overreach. And this narrative and additional frames that are mapped to the various movable audiences that Jay walked through are all detailed in the messaging guide. So as we're thinking about how to tailor conversations, we know we need to differentiate based on our audiences. I think we all know this, but the research made it very clear, and a practical takeaway for you is that this research showed that lawmakers and voters need very different things. Right now with voters, broader values and economic stakes resonate. With lawmakers, especially with conservatives, near-term proof points, constituent impact, and standalone solutions are far more persuasive than comprehensive packages or long-term investment and ROI arguments. We know that conservative lawmakers generally believe in the importance of this period in a child's life, but they're more likely to think that existing programs are already meeting families' needs. So those near-term proof points aren't critical. Democratic lawmakers, on the other hand, are more likely to already see the gaps, which gives more room to lead with needs-based messaging. And all of this, again, you'll find a deeper dive in the guide that we created on messaging for progressives, for conservatives, and engaging in particular with those movable middle audiences and lawmakers that Jay outlined. So I'm going to turn things over to Nikki to continue to walk us through to the close here.
Thanks, Nicole. So moving forward, when we think about the solutions, when we think about lawmaker messaging, we have to remember that they have short-term limits, as Jay said, and their needs for what they want out of the PN-3 policy messaging reflects this. So these standalone short-term policies are the most effective. Policymakers want to hear about changes that will immediately benefit their constituents. And standalone policies, rather than big bill packages, are what they really value. If you think about it, it's harder to get groups of politicians to agree on a big spending package or changes, and they're less vulnerable to rollbacks if an administration's priority changes. So if we use a recent example, the One Big Beautiful Bill, there's a child tax credit bill in there, but if the administration's priority changes, or if a different administration's priority changes, then that entire package could be repealed, which would then affect the child tax credit. So lawmakers really wanted us to emphasize that these small standalone policies are much more effective for them. It's also important to mention that universal eligibility language is especially something to be aware of, especially when it comes to conservatives. So we found that families who are struggling, families who need help right now, families who cannot make ends meet, that kind of language consistently outperformed more universal-based language, like all families deserve this, especially among conservative lawmakers and audiences. And there are exceptions to this rule, of course, which we detail in the guide, but as a broad rule, I think that's really important to note. And lastly, local stories and local proof points are some of the most effective in reaching your target audiences because lawmakers want to hear how their constituents specifically are affected by the things that are going on. So being able to pull from local childcare laws or programs and how they've changed and affected and improved or reduced the capacity for kids to have better outcomes is where lawmakers will find things really persuasive. And looking at our messaging guide, which I know Andrea will drop in the chat for you all of this is available on the NCIT website. We're so excited to share this with you. It also links to the broader research presentation, and it includes clear research-backed messaging suggestions. And that includes a lot of different things like how to message depending on who your audience is, a deep dive into both conservative and progressive lawmakers and their thoughts and feelings, some of the most persuasive proof points on why PN3 matters, some of the best messaging frames for each audience, and sample messaging for policymakers and voters. And then this just, I realize it's kind of hard to see, but this is kind of like an overview of some of the guide. And you can see on the right, we have counter messaging, which is something I really wanted to call out. We address some of the most common opposition messaging that we see and how to work through them. And on the left, we have the 3 frames, and we break down the effectiveness depending on the audience and provide messages tailored to each group. And depending on who your group is, whether it's pessimistic skeptics or one of the other groups, we also try and break down what kinds of proof points are most effective for them. So when you're using the national proof points, which as we said, should always be combined with local ones, you're coming at them with what we know works best. So that is our presentation. We will hold the last 15 minutes for questions. I know Andrea will be sharing a poll in the chat really quickly. If you all can quickly do that, that would be wonderful. And then we will move into answering some questions.
Thank you all. Well done on carving out some time here. There's been a lot of conversation on drilling down into the every child, every family deserves framing and universal and to the idea of calling out the idea of families that are in need or struggling. And so I wanted to maybe pause and have a conversation about that, and how I'm trying to pull out questions here. Is there an not so overt undertone of racism here, that some people are more deserving of support or others? Were there any indications of this mindset in the research? And how does this idea of drilling down on the idea of by need play with a lot of the conversations and research out there right now about talking about this care in terms of universal supports? So, research team, I'm going to lob it over to you to dig into this. And if anybody who put questions in the chat want to come off mute and get into a conversation, since there was a lot of talk about this, we encourage that as well.
Sure. Thank you. I'll just say a couple things here and encourage my colleagues to chime in. But first thing is, I think that the idea that everyone deserves an opportunity isn't the same as saying that the government should pay for it, or that it should be a government program. So I think that's the first thing I would point out. And then the second thing is not related to this project, but I just, for another project, did an extensive piece of research on this idea of who voters think is deserving of support from government programs in particular. And yeah, there is a fair degree of bias and prejudice views, depending on where folks sit in terms of their political views, in terms of who is deserving of support for government programs. So I think that's a reality that is foundational to all of this.
Yeah, and I would say on the point of should programs be available to all, or should they be available to some, the slide that Eleanor covered. We know from the qualitative research we did with voters that when we asked them that in the qual boards and in the focus groups, their reaction was more, well, there are plenty of families that can afford all this stuff themselves, and are currently doing so and are doing just fine, and they don't see it as a good use of limited resources to expand programs that a lot of families can already afford and pay for them for those families as well. So they're really separating that question from the deservedness question. They really are two different things in regular people's minds. And on the deservedness point, I do think it comes down to making the case, and we did a little bit of this in the qualitative with voters, and they kind of got there themselves, that the idea of excluding help from families who do very clearly need it, from children who very clearly need it, is something that kind of makes people feel a little sick to their stomachs. And don't want to, even if they dislike that parents aren't working, or that they continue having children when they can't afford it, or any of those old yarns, they still don't want the children to suffer. And so sort of bringing it back to all children really do deserve the chance to thrive, and many aren't getting it, is a pretty compelling way to reach people where they already are without kind of having to drag them along too far.
I was going to toss it to you, Eleanor, so I just come off mute. Perspective.
Yeah, I think definitely echoing. Rebecca and Jay both covered it pretty well, but I would say, just when talking about the need, if you're thinking about extending this, I think making the case for, like demonstrating that families do need this, like demonstrating the need, because they see it. But I think if you're trying to expand it more, showing that it's challenging for families it's not just those who are in poverty, maybe. I think like demonstrating that need can help communicate that, because I think when people do see the need, then they are inclined to support it. It's just the idea of government giving money to everyone, even people who really don't need that money, is something where that's what raises some of the more objection to the kind of all families getting access to these programs and services type language there. I will say, kind of separately from this research, too, when you are trying to talk about things within a kind of equity framework to Republicans, not using the word equity, but it tends to go over a little better if you are, again, talking about that need and the kind of financial thing. So that, even families who don't have the ability to pay for this themselves, their children deserve this opportunity, is something that resonates more than if you are taking a specifically racial focus. I know that doesn't really answer your question about whether racism influences this about who like feelings about deserve, but just in terms of a communication strategy, if you're talking about conservatives, if you can avoid that piece of it and focus more on the need and income kind of across a range of different things and other research we found, that tends to be better received.
Melody, I don't know. Yeah, I was going to say, I don't know if you got tired and put your hand down, but I saw your hand was up and I wanted to lob it over to you if you want to come off mute.
Yeah, just really quickly, because I have a three and I have to jump. I'm really grateful for this document. Thank you so much. I think in Pennsylvania, our very, very small margin, our General Assembly, a lot of these talking points are going to be very helpful, especially as we try to build support eventually for a child tax credit. I just want to say for the record that I think the erasure of language around equity is eventually going to be traumatic for a lot of people in the field because it doesn't go away because of federal change in policy or communication strategy. All the work that we've been doing for the past 70 years is still happening. It hasn't changed. In fact, it's getting worse. All the data we've been working on is still happening. It's still happening in environmental policy, health equity policy, zoning, public safety, child mortality, maternal and infant health outcomes. And it feels very itchy, and I'm being very, very PC when I say that when I, as an advocate, am working on policy change and I have to look at a document and it's saying, don't say language that's going to offend people that are ultimately using very socially violent language and racist rhetoric because it's going to hurt their fifis, but do it anyway because we have to get legislative champions. That sort of erasure is traumatic to all the people who are Black, brown, people of color, LGBT. That impacts the children of those communities, the parents of those communities, the workers of those communities, the communities themselves, the communities that we don't even talk about because we pretend that it doesn't exist. And I respect completely the work that you're doing. I think it's still important that we focus on the priorities of prenatal to three, but there's some points we have to reconcile that there is some things more important than just legislative wins because entire communities' voices are being silenced. And I don't think that legislative advocacy for the sake of itself is more important than the health, security, safety, and well-being of those communities, the advocates, and the people who work within them and on behalf of them. So I want us to center those people in our work and their voices and their messaging.
And I will say, I absolutely recognize and appreciate that, and I thank you for bringing that. I do want to clarify when I'm saying that it really is talking about a strategy, and I absolutely understand the tension of like those things being important to voice. It's more about from in the field that I work in, when you're talking to this audience, if you're trying to get that entry point, what do you lead with? Understanding that some of those things are like that it is not about those things not being part of the conversation at all. But with those people, if you're trying to bridge those people who something like that is going to instantly throw up a wall with them, then it is
I completely
it is a
understand.
trade-off. So yeah, so
I
it is a
completely
trade-off, but
understand,
yeah.
Eleanor. I'm just saying, as advocates, I feel like at some point I have to speak up and say this. When I enter a room versus other people enter the room, and I'm talking about these talking points, and they're all true and valid, and I love the document, and I think I'm going to use it, as I said from the beginning, to talk about the child tax credit or other things. When I'm not using the language, I'm erasing myself. You see what I mean? I'm not talking
Yes.
about my own experience in the work. And I think that has been a dividing line in a lot of our advocacy since January 20th, 2025. And I don't think the field has been honest about that. And I think that we have to reconcile that in the work.
Yes.
There has
And
been an
I think
erasure of people in the room. And I think there's just been an active erasure of people on the call, and there's been an erasure of the communities we serve. And I don't think we fully understand just yet of how to continue doing the work well from a place of good faith while still trying to champion a lot of these policies because we're afraid of losing our funding. We're afraid of there's real things at risk. I'm not attacking you or the work. It's great work. I just think that we need to think about that as a field because it's an entry point for some people and it's closing the door for others. And I don't think I would be remiss as an advocate if I didn't say that.
Yep.
And I will say when because I've had conversations like this with others as well. And I will say it's one of those where I think when you kind of make that choice, it is because it does come down to a like values thing and kind of ultimate goal there. I think it's more that just recognizing, which I'm sure I don't have to tell you, that when you do voice those things, that it's going to be more challenging with certain groups. I'm not saying that's right. I'm not like that's, but that it just is just that's kind of what we find. But I think that it is definitely kind of is recognizing the importance of that. And if you feel it's important to center that in your language, you can do that. You just will, with some of these audiences, are going to face some challenges, which I think is nothing new and is not really surprising. So it really is just that's how we're talking about this, is that strategy.
I think, and I want to thank Melody for speaking out about that. And I agree, it is definitely something that we all as a community grapple with. And I think, Allison Fraser dropped some tools in the chat too, that we should consider this as a very specific tool. And then to your point, Melody, the community needs to figure out how do you deploy this with the community activism that you're doing, the conversations that you're having, the way that you are rallying the community behind your issues to speak up. Because at the end of the day, it's going to be more voices that they hear from are going to sway it. So there's a very different way of sitting down across the table from somebody and mobilizing the community behind something that really matters. So I feel like there are lots of different ways in, and 100% hear you and think that that's something the community needs to figure out long game as well. And I know we're 2 minutes to close. I think it was Dana had her hand up. I don't know if there's a closing question. Yeah,
watching the time as well. So anyway, +1 to everything that's was lifted up by Melody. And I think this is why it's really important for those of us who are like professional advocates, like that's our job, to make sure that our advocacy campaigns are grounded in the people who will be most impacted by what we're advocating for, and the decisions that are made about what we're fighting for and how we're fighting for it are made by that community. We can staff that community and provide some like navigation of very inaccessible, messed up policymaking systems that don't encourage their voice. And we have to release control. So it's great information to share. And then community partners will decide, how do we want to talk about this in a way that feels authentic and strategic to us right now? And I've found 100% of the time that community partners are very used to code switching, very used to making decisions like that, very used to weighing the pros and cons because that's literally their everyday life. And so having the knowledge and then releasing the reins is the only way I think to move forward.
Yes. Yeah, I like that. Thank you so much for contributing that as well. We are at time, and I know that NCIT provides a lot of space for just these kinds of conversations. I think there was a few plugs to make sure if you haven't joined the community that you do so. So scroll up in the chat to check that out. All of these materials are online for you to download, think through, and I would say it's not prescriptive. It is another tool for your toolbox that may help in your narrative. But I'll end by saying great work in the field in terms of convincing about the value of this moment in a child's life. But the hard work continues of trying to motivate people to take action. And I don't envy your tasks, but I am grateful for all of you out there doing this work. We hope to have additional rounds in the future, policy specific, state specific, more audiences. So hopefully more to come. But thank you for gifting us with your time this afternoon. And we hope you find this information useful.